Hello, Ibrahim. Okay. Hello, everyone. Good evening. How has been our day? I hope your day has been going on well. Abubakar, we are in class. We employ you to kindly. Okay, you've muted yourself. Thank you. All right. I welcome everyone to today's class. And we are on week 6. Yes, week 6 of this facilitation. And today we'll be going to unit 5. Unit 5, and I just uploaded the instructional video. I had a busy week. I didn't manage to do that yesterday as had planned and thought I would be able to do that. All right, and today's topic is healthcare resources, monitoring and evaluation of health services. That is the topic or the title of Unit 5 that we will be dealing with this in this 1 hour of class interaction. So when we say evaluation, monitoring, and healthcare resources, what do we understand? These are what we are going to be unpacking in the next few minutes. Healthcare resources, what do we understand by healthcare resources? Monitoring, at the same time, evaluation. When you say you're monitoring something and you're evaluating, is it the same thing? If it's not the same thing, we want to understand the meaning in the context of health science. But before we dive deep into the class of today, I want us to quickly go through the learning objective or learning outcome of this unit. Of course, you know that for every unit that we've had, we normally have a learning objective or learning goal for it. And so I'm just quickly going to share my slide to share with you the learning objective for this course. And so one learning objective is that at the end of today's class, learners should be able to describe the measures to develop human resources for health. What do I say? I said learners should be able to describe the measures to develop human resources for health. Another learning objective is learners should be able to explain ways of ensuring community involvement to be adopted by the Ministry of Health. We have various ways by which we can involve community participation, community as a whole, to participate in the health program. So we'll look at various ways and explain those ways or those ways of ensuring or involving community members in health. And the third one is learners should be able to describe the whole scope of health manpower. When we say manpower in the health sectors, what do they entail, or what does it entail, or what does this manpower comprises of? And the last point for the learning goal is that learners or students should be able to explain the actions required to develop monitoring and evaluation process as part of managerial process for national health development. That is part of the obligation or part of the managerial role is to monitor what is going on in a community, and not only that, also to set goals. And when goals or objectives are set, to evaluate it. Is this goal being met, or has it been met? And so on and so forth. So that is the learning objective for this course, for this unit, I mean. And so to ask you as a class, don't forget, I always say that this is a student-centered form of learning. It is not teacher-centered. So, and that is where I'm to facilitate and not to teach or not to lecture. And for that reason, I would crave your participation and your involvement. So, what do you understand by health resources? Let's start from there. Let me share your thoughts on that. Let me share your thoughts on that. Huh? I'm listening. When you say resources, what do you understand by resources? Is there anyone that wants to share his or her thoughts on that? When you say resources, what do you understand by resources? Eoma, welcome. I'm waiting. Who wants to share his or her thoughts? When you say resources, don't forget the topic or the title for Unit 5 is Healthcare Resources, Monitoring, Evaluation, and Evaluations of Health Services. Then I ask the question, when you hear the word resources, what do you understand? And don't forget, the key point in this unit is actually resources monitoring and evaluation. So which we are going to unpack. Who wants to try? Okay, while I'm waiting for someone to open the floor. Okay, Susan, I can see your hand. Okay, let's hear your thoughts.
Let me just try.
Okay.
I can say that resources can be things or materials needed to achieve a certain goal.
Okay.
That's what I understand by it.
All right, thank you for that good trial. Yes, you are right. That resources are actually they are materials, or they are objects or things that is needed to meet a target needs. To meet, but in this context, is actually to meet many health needs of a community, because we are dealing with primary health care concepts here. So in particular, resources are needed to meet the many health needs of a community. And at the same time, no nation, however rich, has enough resources. That is very important. Every nation, and that is why that there is no man, that one man cannot make a forest. So we need the support of another. So that's why they say that there is no nation, no matter how rich they are, that has enough resources to meet all the needs of all aspects of healthcare of its citizens. No, that is very important for us to understand. And for that reason, the basic resources for providing health Sorry, I went to mute myself. No sound. So sorry. So sorry. I didn't know that I mistakenly muted myself. So sorry about that, everyone. So sorry about that, everyone. Can you all hear me now? Can you all hear me now? Okay, so as I was saying, that human resources is very important, and human manpower is very, thank you very much, is very important when it comes to healthcare resources. So manpower is very important. Another point that I want us to consider is the fact that another point is strategy or definition of the terms that we have mentioned. Don't forget we mentioned health manpower, money, and the materials as the three main resources that is needed. And when we say health manpower, it includes professionals. And when we say professional, automatically what comes to your mind is the doctors and the nurses, okay? The lab technicians, and we also have the auxiliary health personnel when you talk of the traditional birth attendants and so on and so forth. So even the community health workers as well. And so we are saying that health needs demands of the population. The manpower require a country that are based on health needs and demands of the population. The health needs in turn are based on the health situation and the health problem and the aspiration of the people. What about the desired outputs? When we say desired output, that is the preventive measures, the promotion of well-being and good health, and the curative, that is when the health is affected now. How do you cure it? The rehabilitation or control or the total eradication of that disease. That is what we mean by the desire. And we also have sectors or distributions. The healthcare system is very important to know that their intention is to deliver the healthcare services. And in Nigeria, it is represented by major sectors or agencies which differ from each other by the health technology applied and by the source of funds for operation. And what are these sectors? We have the public sector, we have the private sector, we have the ingenious system of medicine, we have the voluntary health agency, and the non-governmental organization. So in other words, the different health sectors distribution that we have in our context as a nation, Nigeria, that's what we call government hospitals. So those are classified as public sectors. And then we have individual homes or religious owned. That is what we call private sectors. And we have the indigenous system of medicine. Those are what we call traditional healers and so on and so forth, traditional medicine Yeah, another one is the voluntary health agency and non-governmental agency. So we look at the public sector. Under the public sector, remember last week when we met, we looked at the federal government and we look at the states and we look at the local government. So when we say public sectors, what does it entail? We have the primary health centers, we have the hospitals or the health center specialist hospitals, and we have the health insurance scheme. So under private sectors, that is for public sector. Now we have 3 points other that. Let me just share my slide on that so that you can see for yourself. Okay, can you all see my slide? Okay. All right. So I was saying that the different sectors, we mentioned the public sector, the private sector, the indigenous or traditional sectors, and we also have the non-governmental. At the same time, we have the voluntary sectors. Then now we are looking at each of these sectors, and I said that public sectors, what are the things that are under examples of public sectors, examples of private sectors, example of indigenous system of medicine, voluntary and non-governmental. So that's it on the slides. As you can see, as I've shared my slide. The next point I want us to look at is the rural-urban distribution. Of course, we know that the rural-urban distribution is a thing of concern to many of us because we know that the ratio of population of people in the urban, it's compared to the rural, and the resources that are in these two places, it's not the right ratio. So that's also important, that planning and ratio in relation to population. You know, we have more people in the rural setting than in the urban area. But when we look at health facility, we have more health facilities in the urban area compared to the rural area. So, and we know that the role or the supports that the government, in addition to WHO, is giving to ensure that everyone has that total health coverage is achieved. Remember when, I think it was in week 3, when we discussed health for all. Yes, health for all, but here we are in 2022. We know that we have still not achieved it, but gradually, slowly, but surely, we hope to get there. So the next point that we want to look at under health resources is financial and material resources. We've looked at it, that financial and material resources are also important, as well as manpower resources, So, and I will employ you to please kindly go through the slide, the instructional video, and try to understand how allocations are made when it comes to financial empowerment of healthcare resources, healthcare programs in our community or in our country. We have reviewed distribution and reallocation of health budget. So we have different ways by which the government allocates budget. And like we were saying, in terms of the rural urban setting and the population. So it's important to note and look at that ratio. I think, yeah. So when we say review, we have review of allocation of health budget to primary health care at the peripheral and at intermediate and central level in urban and rural area. Yes. Reallocation of the existing resources is also there. Analysis of the needs is also there. Consideration of the cost effective of different technologies also is there. So the next point I want us to look at is to go to evaluation. So yeah, let's talk more on monitoring before evaluation, because you have to monitor something before you evaluate it. So what do you understand by monitoring? What is monitoring? If I ask you, thank God that I'm speaking with, I know we have some environmentalists among the audience, the public health student, as well as the nursing students. So what do you understand by monitoring? Let me see your electronic, okay. Ioma, you may go ahead and share your thoughts.
Hello?
Yeah, we can hear you. Go ahead.
Good afternoon, everybody.
Good evening.
Good evening. Monitoring can be defined as a day-to-day follow-up meetings. During their implementation, you follow up that what you planned, that you achieve it, or to know whether you achieve it or not. It's just a day-to-day activities, follow-up of activities. Thank you.
Okay. Thank you very much. Just to add what she has said, that you first have a plan. This is what I want to do. Day 1, day 2, day 2, in order to achieve this. Just like, let me take for instance, because I'm a nurse by profession, so I'm going to use my profession as an example. A child is brought to the clinic, is having 40, let me even say 39.5 degrees Celsius. So in my plan, I want to tepesponge this child. Well, I'll first expose this child. I'll give this child cold water to drink. I would open the nearby windows, and I'm going to tepesponge this child. At the end of the day, I want to bring out the temperature of this child by 1 degree Celsius or by 2, or after 30 minutes, the temperature should have come down to 38.5. Then after 1 hour, the temperature should have come down to 37.5. So how do I know if I'm achieving my aim? Is I have to be checking the temperature. I have to be monitoring the temperature, whether I'm going to be doing it maybe every 15 minutes or every 30 minutes. So that is monitoring in a nutshell. And so we know that when we are monitoring, it has to be consistent. You have to be consistent in tracking what you are aiming to achieve. So now we want to compare monitoring and surveillance. You will look at it Now, what is the difference between monitoring and surveillance? We've just looked at the definition of monitoring. However, it's not the same thing as surveillance. Okay, so I'm not going to ask for the definition for you to define monitoring again. We've seen, so it's just a to rephrase what's the definition that Ilma said is another way by putting it that is a performance or analysis of routine measurements. You know, you are performing a routine day by day. This is just English, okay? What is the aim? You have a target, you have a goal to see that if you are achieving your targets. So, and there is an example here also that is given on the slide here. And I said, where I said that I can monitor air pollution. We can monitor water quality, growth and nutrition, or the nutritional status of a child. Yes, we can monitor it. And we can also monitor the quality of water that is in a community. So these are the things that can be monitored. And because they have an ongoing health services or health professional, or to an extent to which this patient or this program is being achieved. Any question? Any question? Let me check. Someone just sent a chat. Okay. All right. So if there is no question, then what is surveillance? What is surveillance?
Hello?
Okay. Let's hear your thoughts.
Hello?
Yes, we can hear you loud and clear.
Yes, surveillance is just a means of keeping watch with great attention and authority of the minute details of a situation. Here is just, you are keen over the attention and authority. You have the attention and authority over a situation. Unlike money. Yes.
Okay. Thank you very much for that contribution. You will see in surveillance, the difference is, okay, let's hear the thought of Sunday. I can see your hand. You're welcome to class.
Thank you, ma. I was trying to join since
Okay. Can you be a bit louder, please?
Okay. Surveillance is the process of keeping track of a particular program that is trying to look at the progression, how the program is actualizing its goal. So keeping track of what is happening. That is a program that is initiated. So it should not be left alone. You keep track of it, watching it, and trying to pick with the aim of improving the system if there is any fault that is detected because of watching over the program. That is surveillance.
Okay. Thank you. You see that there is a thin line. Okay. Thank you, Sunday. You can lower your hand. I can see Kate. Kate, let's hear your thoughts.
All right. Good afternoon.
Afternoon.
To what an authority.
Can you be a bit louder, please?
It also means to watch over with great attention An authority
Okay.
to give details and situation.
Okay. Thank you for your participation. Thank you also for sharing your thoughts. We've seen that it's a thin line that we have between surveillance and monitoring. But when it comes to surveillance, you are more thorough with surveillance. You are taking cognizance of every detail, every minute detail in it when it comes to surveillance. And we have objectives of surveillance. When you're doing a surveillance, one of the aim or the objective is to provide information about new and changing trends. You see, there is a trend that is going on. Then you want to provide information on that trend in the health sectors of a population. And it can be, maybe there is mortality or the nutritional status, indicators of environmental hazard, and so on and so forth. So you want to provide what is the information. That's when you do a surveillance. Another objective of doing surveillance, don't forget that surveillance, monitoring, surveillance, and evaluation, they have purpose in which you do them. You don't just say, no, I want to do a surveillance. You must have a purpose or the objective. And part of the objective is what we are learning today. Another objective is, let me even ask before I start giving it to you. Okay, who wants to share with us some of these objectives of doing surveillance? Okay, let's hear your thoughts.
Hello?
Yeah, Victoria, go ahead.
One of the objectives of surveillance is to provide information about a new trend in the health status of a population. Like if there is any outbreak of a disease that is causing increased mortality rate, or that is causing in the nutritional status of a community to be reduced. So we have to keep surveillance on such a disease in order not to prevent it from increasing in number, so that the outbreak will be reduced. Then another one is that it helps us to provide feedback on the ones that we are about to do and what we expected to get, the feedback of what we have embarked on. Then the third one, you can say it provides a timely warning on public health disaster. If there is any health disaster, surveillance will make you to put a break to it, to act fast in order to prevent it spreading more. Thank you.
Okay, thank you very much. Thank you very much for sharing your thoughts on the objective of surveillance. And don't forget the title of the unit we are looking at is healthcare resources, monitoring and evaluation. So the last point that we'll be looking at is evaluation. When we say evaluation, what do we mean by evaluation? It's the process by which results are compared with the intended objective. You have an objective, then you look at the result. Did this result meet your objective? Or more simply, the assessment of how well a program is performed. In other words, you do an evaluation to consider during your planning and implementation stage of a program or activity. So evaluation is very crucial, very, very crucial in identifying health benefits derived from either impact on mobility, mortality, and patient satisfaction. Victoria, your hand is up.
Oh, sorry.
Oh, okay, all right, it's not a problem. So in other words, evaluation is very useful in identifying performance difficulties when you want to look at how are we performing in this area. You just do an evaluation, then we can see that yes, we are performing well or we are not performing well. And also the reason for evaluation are as follows. So you do an evaluation for health services to have more, to become more complex. And there has been a growing concern about the functioning both in the developed and the developed countries over the question that is raised on the quality of medical care and the utilization coverage. I know that when we go into that now, it's a big thing when you talk about the utilization and as well as the quality of health service that people get. So what are the process of evaluation that we have? The element of evaluation process. Okay, Ioma?
Yeah. It must be relevant to.
Yes.
Adequate.
Yes.
It must be when
yes.
you are accessible.
Yes.
Affordable.
Yes. Very, very important. Yeah. Thank you. Thank you. It must be adequate, relevant, accessible, and acceptable. So these are the elements of evaluation process. And also it must be efficient. It must also be efficient. It must also have impact. It must also have impact. And planning and evaluation also must be viewed as a continuous interactive process that will lead to a continual modification. During evaluation, you can go back to your drawing board and see where you need to enhance, what you need to do better. So that is the good thing about evaluation. You can enhance it. You can look at, okay, what do we need to add to our plan to make it more effective for us to achieve our goal. So successful evaluation may also depend upon whether the means of evaluation were built into the design. That's another important. At the planning phase, the means in which you want to evaluate must factor into the planning phase. So that will also contribute to the success rate when it comes to evaluation. So, and that is all that I have for you in today's class under Unit 5. Any question? Any question? For those of us that are able to make it today, honestly, I must say that I appreciate your time and I appreciate your participation. I always crave for your contribution, and I thank you all for making out time to attend this week's class facilitation. Okay, you may speak, Victoria.
Yes,
I can see your electronic end. Let's hear you.
Hello. Thank you very much for your wonderful lecture. But all these things we are learning in Nigeria, that is our country. I have not seen most of our health authorities plan to meet our health needs, because is it that we are learning to impart it in our country, or we are learning to impart it in foreign countries? Because all these things happens in foreign country, but not in Nigeria. I don't know. Because all these things, if it is being implemented in Nigeria, we'll have a better healthcare system. Thank you.
Thank you. If I was offline, I was going to talk more on that, but because this lecture is being recorded, allow me not to make contribution on that, because ideally, it's supposed not to be theory alone, but unfortunately, you and I understand what is going on when it comes to the quality of healthcare services, especially at the grassroots level, even at secondary and tertiary level. The other day, okay, I think it was last year, I was in Nigeria and I followed a friend to see a child in the hospital. Honestly, it wasn't nice. But anyway, let's pray for our leaders that they will key into the vision of the health of the citizen, and they can do the needful. So as we come to the end of the class, Musa, I can see your hand up. Let's hear your.
Yes, ma. Good afternoon.
Good afternoon.
Thank you for a good lecture, even though I came late because I was very busy doing things. I really enjoyed the part I was able to listen to. My concern here is about the nature of our examinations, which this course is included. Sometimes I don't know. I say which this course is also included during our examinations. I don't know, maybe the assessment. I know that is TMA and the examination we are writing, which is POP. Sometimes you wonder, you may perform at least based on your mind, you think that you have done something good. But unfortunately, you end up failing some. I don't know about this course. I need more light on that. Thank you.
All right, thank you. Please let me just say that let's just keep attending. For this semester, I'm going to have an interactive session with you the last week of this class, so we can talk more about exam-related issues by the 8th week. Okay. So this is where we are going to leave it for today. Susan, we are 5 minutes late. I have another class immediately. Please, can you just post your question on our WhatsApp group and I will address it. Thank you. Have a nice day. Bye.
Okay, bye-bye. Bye-bye.